It's a diagnosis that no one wants to hear. Each year, more than 40,000 people in the United States are diagnosed with cancer of the pancreas, and the numbers continue to rise. The news often brings anxiety and fear, not only for the patient, but for the patient's family as well.
I thought it was a death sentence, because not having known anyone who had pancreatic cancer, personally anyhow, everything I had heard had been negative about the cancer, and that it was probably the worst type of cancer to have because frequently it resulted in death as opposed to remission.
Though the news may be overwhelming, finding an experienced doctor who can explain treatment options and provide exceptional care is key to having the best possible outcome.
I would tell the patient, don't sit on it, don't wait. Either reach out, ask your doctor, and say, where do I go from here? Can you help me? If your doctor has no idea of what to say or help you or how to help you, get on the internet, start searching, plug in pancreas cancer.
The early stages of pancreatic cancer often go undetected since symptoms can be minimal or non-existent. Unfortunately, many patients learn about their condition once the cancer is in an advanced stage.
And that's one of the hardest parts about pancreas cancer, is that as much as 85% of the people who have pancreas cancer have spread at the time of their diagnosis. So somebody might be losing a little weight for a few months, then they might turn jaundice, somebody gets a CT scan, and then already the tumor is showing places to spread, most commonly the liver.
I had a lot of back pain, and we did some testing as far as CT scans and MRIs, and doctors were not able to find anything in my back that would cause pain. They did find the spot on the pancreas, but again, they didn't feel that that was where my pain was coming from.
Most of the cancers are in the head of the pancreas, which is on the right side of the body. So for those cancers, what we tend to see our patients have, first of all, very nonspecific things like weight loss, maybe some nonspecific abdominal pain. So it's not really like people get those and they say, aha, it's the pancreas. It's very something that kind of just brews along for a few months.
Located at Northwest Community Hospital in Arlington Heights, a northwest suburb of Chicago, is the Illinois Center for Pancreatic and Hepatobilary Diseases. The center's medical director is Dr. Malcolm Villamoria, a nationally recognized surgical oncologist who specializes in liver and pancreas surgeries.
These patients are living their lives. Everything's going fine. Businessmen, everything's just going great. And then all of a sudden they're struck down by a cancer kind of in the middle of their life, and it's almost like a lightning strike. And then so they're trying to pick up the pieces and move on. And my feeling was I'd just love to be able to be part of that and see if I can help them, see if we can get them through this struggle.
But there is good news. Treatment options continue to evolve and survival rates are improving.
We have really the most up-to-date scanning here that I've ever seen at any hospital I've been at, to the extent that we are able to really evaluate these patients preoperatively to try to get a very good idea of what can be done and what can't. We do certainly see patients who've been operated on elsewhere by surgeons who tried to do a Whipple procedure or tried to do a pancreatic resection, who during the operation said, oh no, this one's too locally advanced. So they come to Northwest Community Hospital here in Arlington Heights, they come to our pancreas center, and we are able to say, okay, based on our studies and based on our specialized scans, is there something else we can do for you? You come in here and it is one place where we're going to wrap our arms around you and take care of you completely from start to finish.
The center's staff is dedicated to utilizing the latest medical advances in testing and treatment while providing compassionate and individualized care.
One of the great things that helped was that Dr. Villamoy always had a positive outlook. He gave me the best and worst case scenario, but he gave it with hope, and that, explaining all the steps along the way.
I would recommend Northwest Community Hospital because of the staff here. The staff here is extremely caring, they are very loving, and they treat you like they're your family.
We had an outstanding experience here.
Surgical treatment options include the innovative Whipple procedure, a complex surgery to remove tumors in the pancreas.
What we're doing is we're removing what's called the head of the pancreas, the duodenum, part of the bile duct, the gallbladder, and then we're putting everything back together again. We don't remove any part of the stomach. Some people do remove part of the stomach. That's a standard Whipple procedure. We preserve the stomach, or preserve the entire stomach, which is called a pylorus preserving Whipple procedure. So the stomach is saved. That helps patients in the end as well in terms of eating better or getting back to activities quicker.
Though there are risks associated with any surgery, Dr. Villamoria and his team remain committed to providing their patients with the best care, treatment, and outcome.
I always tell other patients, families, that you see more raw courage in the waiting room of a surgical oncologist than anywhere else in the world. These people come in, they're scared, they don't know what to expect. Some of them have never had surgery before, and they're looking at getting some of the biggest surgery they'll ever have. They realize it has the potential to be life-saving. There's been several cases of complete home runs where patients have been told, hey, you know what, there's nothing for you except chemotherapy and get your affairs in order, and we've been able to do downsized tumors, or even operate on those patients right out and get them a good operation where we've completely been able to remove the tumor.
The Illinois Center for Pancreatic and Hepatobiliary Disease at Northwest Community Hospital, providing help, hope, and treatment for patients with pancreatic cancer. Find help and hope at Northwest Community Hospital. Each year, more than 40,000 people in the United States are diagnosed with pancreatic cancer, and that number is on the rise. But hope, help, and healing is available for pancreatic cancer patients at Northwest Community Hospital in Arlington Heights, a northwest suburb of Chicago. The Illinois Center for Pancreatic Cancer and Hepatobiliary Disease offers a comprehensive and team approach to treatment while providing compassionate care. Find help and hope at Northwest Community Hospital.